A very good morning, everybody. Today we will be talking about the skeleton of the foot. So, as you can see here, the foot consists of the tarsal bones, the metatarsals, and the phalanges. The tarsal bones are 7 in number, and they are arranged in 2 rows, a proximal row and a distal row. When we look at the tarsal bones are this one is the talus, this one is the talus, this one is the calcaneum. The talus then articulates anteriorly with this bone. This is the navicular bone, which articulates in front with the medial, intermediate, and the lateral cuneiform bone. The calcaneum then articulates with this bone, that is the cuboid bone. So we have 7 tarsal bones: the talus, the calcaneum, the navicular, the cuboid, the medial, intermediate, and the lateral cuneiform bones. These tarsal bones articulate with the metatarsals and they complete the skeleton of the foot. These bones form 2 arches. We have a median longitudinal arch here, and we have a lateral longitudinal arch, as you can see here. So this is the skeleton of the foot. This is the first metatarsal bone, second, third, fourth, and the 5th metatarsal bone. So this is the foot of the right side. Let's talk about this bone, that is the talus. This is your talus. Now the talus is the key bone of the skeleton of the foot, as it connects the foot with the leg. On the superior surface you see the articulation of the tibia, whereas anteriorly and inferiorly there is articulation with the calcaneum and the different tarsal bones. Now let's talk about this bone. This is how you hold it anatomically. So when you look at this talus, the talus has a head, then we have a constricted part called the neck, and we have an expanded part called the body. The head is rounded and it is directed downwards, forwards, and medially. So if you hold it, this is the anatomical position. It will be downwards, forwards, and medially. Then you have this constricted part that is called the neck, and this expanded part that is the body. For side determination, the head has to face forwards, downwards, and medially, whereas the superior surface of the body should be convex. So this is the talus of the right side, as you can see in the skeleton. Okay. Now, let's talk about the different parts of talus. First, we have the head of the talus. This head is rounded. It has an anterior part and an inferior or a plantar surface. This is the inferior part or the plantar surface of the head. Both the parts are covered with articular cartilage, as they take part in formation of different joints. Anteriorly, the anterior part that is covered with the articular cartilage will form a joint anteriorly with the navicular bone, as you can see here. So this is the head, the anterior part. The anterior part of the head is articulating with this bone, that is the navicular bone. On the plantar surface, we have 3 articular facets which are separated from each other by indistinct ridges. This one, this is the posterior one, this is the middle one, and here we have the anterior one. The anterior one becomes continuous with the articular surface of the head. The posterior one articulates with a shelf-like projection. This is the heel bone or the calcaneum. So there is a shelf-like projection on this calcaneum that is known as the sustentaculum tali. So this articulating surface articulates with the sustentaculum tali. This is how the talus is present in the body like this. Okay, so when you see this surface, this posterior most surface is articulating with the superior surface of the sustentaculum tali like this. Okay, then we have this lateral surface. This lateral articulating surface articulates with the anterior articulating facet that is present on the superior surface of the calcaneum like this. Okay, so this is how it is present. The anterior surface of the head will articulate with the navicular bone, this one. The inferior facets on the plantar surface, 3 facets are present, the posterior one, then we have the medial one, and we have the lateral one. The medial one becomes continuous with the surface, with the articulating surface on the anterior surface. The inferior one the posterior most one articulates with the sustentaculum tali, and whereas the lateral one articulates with this surface, that is the superior articulating surface on the calcaneum. Then coming to the constricted part, that is the neck. The neck is this constricted part. It is rough for ligaments, and it has different foramens, that is for the nutrient vessels that enter it. You can see the neck, the head is directed, the long axis of the head is directed downwards, forwards, and medially, and it makes an angle of about 18 degrees with the axis of the body. Then talking about, then on the inferior surface of the neck, we have this depression. This depression is known as the sulcus tali. This one is known as the sulcus tali. This sulcus tali articulates with the calcaneum, and there is a depression on this calcaneum. This is known as the sulcus calcanei, and together they form a canal that is known as the sinus tarsi. So you can look at it like this. This canal, this tunnel that is formed, is known as the sinus tarsi. Coming to the body is this expanded part. It is broader anteriorly, whereas it is narrower posteriorly. The superior surface of the body is convex, whereas inferiorly it has a large articulating facet. The lateral side of the body presents a triangular articulating facet, whereas medially we can see a comma-shaped articulating facet. Okay. Now, what are the parts of the body? We have a superior surface, we have inferior surface, we have a posterior surface, we have a lateral surface, and we have a medial surface. The superior surface is convex. It articulates with the tibia. The lateral surface shows a triangular articulating facet. This articulates with the lateral malleolus. When you look at the surface, it projects downwards, and this projection on the lateral side is known as the lateral tubercle of the talus, or the lateral process of the talus. Medially, you can see a comma-shaped facet, below which we have rough impression for ligaments. The superior surface of the body is broader anteriorly, and it is narrow posteriorly. The medial margin is straight, whereas the lateral margin converges backwards and medially. Posteriorly, we see the posterior surface has a groove. This groove is for the tendon of flexor hallucis longus muscle. Flexor hallucis longus muscle passes through this groove, and we have 2 elevations that are present, which are the lateral process and the medial process, or the lateral tubercle and the medial tubercle on the posterior surface. Looking at the inferior surface, we see we have a large articulating surface. This articulating surface articulates with the superior surface of the calcaneum. So, to revise it again, we saw that the talus is the key bone of the foot as it connects the leg with the foot. We have a head, neck, and body. For side determination, we hold the bone in such a way that the head faces downwards, forwards, and medially. The neck is the constricted part. Then we have an expanded body. The superior surface of the body is convex. The lateral side will have a triangular facet, whereas the medial side will have a comma-shaped facet. The head is globular, covered with an articular cartilage. It has an anterior surface. It has an inferior surface. The anterior surface forms a joint with the navicular bone, whereas the inferior surface has three facets: the posterior-most one, the middle one, and the lateral one. The posterior one forms a joint with the shelf-like projection of the calcaneum that is known as the sustentaculum tali. The neck has okay, so then this surface, the medial one and the lateral one. The lateral one articulates with the facet on the superior surface of the calcaneum. The neck, as we see here, is a constricted portion. The neck is rough for ligament attachment. We have foramen that are present for the vessels. Inferiorly, there is a groove. This groove is known as the sinus tarsi. This is known as the sulcus tali, which with this groove forms the sinus tarsi, like this. Okay. Then we talked about the body. The body has a superior surface, medial surface, lateral surface, inferior surface, and posterior surface. I said that the superior surface is convex. It's broader anteriorly, narrow posteriorly. The medial margin is straight, whereas the lateral margin converges posteriorly and medially. The lateral surface has a triangular articulating surface, the apex of which moves downwards and is known as the lateral process of the talus. The medial surface has a comma-shaped articulating surface, below which we have rough impression for ligament attachment. The posterior surface has a groove for the flexor hallucis longus, due to which it is converted into two tubercles, that is the medial and the lateral tubercle. The lateral tubercle of the talus can be an individual bone that is known as os trigonum. Now, let's talk about the attachments of. First of all, let's talk about the different articulations of this bone. As you can see here, superiorly, the superior surface will form a joint with the tibia. So this forms your ankle joint. Then anteriorly, the anterior surface is articulating with the navicular bone, and inferiorly it is articulating with the calcaneum as well. So it forms the talo-calcaneo-navicular joint. Okay, talo-calcaneo-navicular joint. Then below the talus, we have the talo-calcaneal joint. These are the different articulations of this talus. Talking about the attachments of talus, you have to remember one thing, that no muscle is attached to the talus. About 3/4 of its surface is covered with articulating cartilages. There are different ligaments that are attached to this bone. What are the different ligaments? First, we will see on the head, I told you the different articulations that take place. Now, on the neck, from before backwards, we have three things. First, here, we will have the capsule of the talo-calcaneo-navicular joint. Then we have the dorsal ligament. here we will have the dorsal ligament of the talo-navicular joint. So first the capsule of the talo-calcaneonavicular joint, then the dorsal talo-navicular ligament, then we have the capsule of the ankle joint here. The capsule of the ankle joint here. Okay. Then coming to the lateral surface, the anterior part of this lateral surface will give attachment to the anterior talofibular ligament, because fibula is attached here. So anterior talofibular ligament on this anterior margin. The lateral process, the apex, will give attachment to the lateral talocalcaneal ligament. So ऐसे याद रखो, ये talus है, ये calcaneum है. Here we will have attachment of the lateral talocalcaneal ligament. Posteriorly, the lateral tubercle will give attachment to the posterior talocalcaneal ligament. The medial tubercle will give attachment to the medial talocalcaneal ligament, and it gives attachment to the deltoid fiber, the deltoid ligament, the superficial fibers of the deltoid ligament. Again, head, we have different articulations. Neck, first we have the capsule of the talocalcaneonavicular ligament. Then we have the dorsal talonavicular ligament. Then we have the capsule of the ankle joint. Then laterally, anterior part gives attachment to the lateral talocalcaneal ligament. Anterior talofibular ligament. The lateral process gives attachment to the lateral talocalcaneal ligament. The posterior part, this gives attachment to the posterior talocalcaneal ligament. The medial part gives attachment to the medial talocalcaneal ligament and the superficial fibers of the deltoid ligament. The medial part, below this comma-shaped articulating surface, which articulates with the medial malleolus, we have this rough area that gives attachment to the deep fibers of the deltoid ligament. So this finishes your talus. Another important thing that you have to remember is that this bone, as it has no muscle attachment, so the main vascular supply is through the nutrient vessels that enter its neck. We have branches from the anterior as well as from the posterior tibial artery that supplies it, and because of this reason, it is non-union is very common in this bone. Thank you.